everyone. Welcome to Let's Talk ACA with JSA. This is our 12th edition. Alex, are you there?
Hi, Kathy.
Hey, how are you?
I'm good. I'm the insurance shark today.
Happy anniversary.
Happy anniversary. I just
We've
wanted
been
to have a
doing
little
this
bit
as
of fun here.
See, I didn't wear a hat this time and you did.
I know you're always wearing the creative hat, so I went and dug this little number out from a previous Halloween costume. I thrifted this bad boy a
I
while
love
back.
it.
So, but boom, what's up, JSA Nation? We're here with the insurance shark and Kathy. I don't know who Alex is, but I'm going to talk to you today. Nah, we've had our fun.
That's awesome. You know what? We get to do this. We're thankful for what we get to do, and we're thankful to be here with all you guys. We've got some updates. We've got some talk. So let's talk some ACA, Alex.
Yeah, let's talk about it. And like you said, happy anniversary. This is our 12th episode. How crazy is that?
Time flies.
I can't believe it. That is wild. But yeah, let's jump into it. Couple housekeeping things first. Again, good afternoon, everybody. Thanks for joining us here today. Everybody should have been muted upon entry into the room. If you can talk or share your webcam, please refrain from doing so. And if you have any questions throughout the presentation, we have the chat function and the Q&A available. So put anything that you want to know in there and we will get you taken care of. Also, this is fully recorded. Always. So if anybody wants a copy of the recording, that will be provided to you automatically in the follow-up email either today or tomorrow. I already saw somebody put in the Q&A, other episodes recorded. Absolutely. If you want to hear any of our previous episodes, just email me. I can send you the recordings. We have all of those available. And today we are joined by our special guest, Saeed Hafiz from over at Pivot Health. Say hi, Saeed.
Hi, everyone. Thank you for having me. I appreciate you guys.
You're on the
JSA,
beach today.
you guys know how to throw an event, so I'm happy to
Hi,
be here.
Saeed. Are you on vacay or is this your home?
I wish. I will be vacationing here shortly. My wedding anniversary is on Saturday, but this is just a little festive since it looks so gloomy outside here in Indiana.
Happy anniversary. You can join our anniversary celebration.
Yeah, congratulations, man. Getting in the vacation spirit, I see. All right. Well, we're going to have Saeed talk about Pivot Health and their products here in just a little bit. But let's jump into it. What are we talking about today, Kathy?
Let's see. Today, we're going to talk about some market data and rate changes. You know, we just have to talk about it. We have to address it because we want everyone to be aware of what's coming up and not to be surprised. That's why we do this podcast. We're going to talk about final rule, and I say that loosely, to be determined final rule. They should name it like draft rule and then maybe name it final rule.
I totally agree.
We've got a product spotlight. We're going to go through some things that we're seeing as brokers for some, things, scams or confusing emails that we've been receiving, and we can discuss that and let you know what to look out for. And then, of course, we've got Saeed, who's going to talk to us about Pivot and short-term medical and maybe some ancillary products that Pivot offers. And if we have time, possibly some quoting. So if you don't have your contracts, let us know. Pivot's a great company. They're very competitive, and we want to get you your user ID and logged in.
Yeah, absolutely. Pivot's a fantastic partner. If you guys are looking for any sort of alternatives in the ACA space, other products you can offer, we always say if you're going to do ACA, you have to do short-term medical. Keep that in your back pocket, and Pivot's a great partner. So excited to have Saeed with us here for the official 12th episode. But let's jump right into it. We have again, a few mid-year best practices. I always like to hit this as we have new people on every single one of our podcasts. And also just a bit of an intro for what we're talking about. So like Kathy said, stay vigilant. We have seen in the past few months a few kind of odd, I guess you could call them scams popping up. There's always some things that really target agents around this time of the year and as we gear up for open enrollment that we just want you guys to, of course, be aware of. This is also a great time of the year for anybody that's already doing ACA. This is really a platform that we want to use for everyone. If you're a seasoned agent, maybe you pop in for a little bit to get your update. If you're a brand new agent, you're hearing us talk, discuss kind of what it's all about. We are totally open to questions as well. We want to kind of make this like a forum for you guys. So, with us being in the middle of the year, we are also currently, at least for the federal marketplace, kind of in that time frame where certifications are currently closed. It's a little bit of a holding pattern until things open up again. Agents are working on their contracting, working on their follow-ups. This is a really good time of the year to touch base with your clients. Say, hey, I know open enrollment is coming up around the corner. How has your plan been this year? Have you experienced any sort of pitfalls where you feel like you're paying something out of pocket that maybe you shouldn't be? Can I help with that in any way? So follow up and make sure that not only is it a good time to cross sell, but like you see there on the screen potentially, this is a good time to make sure that your client's premium is still up to date. The marketplace or any state-based exchange, you can adjust that premium as you go to make sure that your client's not getting hit with a surprise at tax time. So say, hey, have you had any major changes this year in your income or your work? Uh, is there anything that I can help you update to make sure that we're staying on top of your premium and keeping that current for you? So now is a good time of the year to follow up and also ask for referrals. Hey, do you have any friends or family that I could help out as well? I'm a community agent. I don't just do Medicare or ACA. I do all kinds of different products. So take the time, make that touch because we all know that if you build that relationship with your client, it's going to be a lot easier to touch base with them during open enrollment as well. So be proactive. This is the time of the year for it.
Yeah, Alex, not everybody thinks about contacting their insurance agent. Let's say you got laid off or changed jobs or you're in between something and you can still afford your premium, but you haven't notified anybody. And let's say you don't find work or go back to work for the rest of the year. That reduces your income and that could change your premium for a lower rate.
Absolutely. And, I'm kind of an example of this myself. I can't remember the last time I talked with my car insurance agent. Things
Sure.
roll along smoothly, things are good as they are, but you as an agent obviously have more of the industry knowledge and the value to offer those clients that they may not even know is sitting out there. So don't be afraid to reach out. We also have our own CRM that can help you with that if anybody is in need of sort of a client resource management system. But this is a good time of the year to do it while you're doing your certifications and all that good stuff. So, all right. So here's our first quick topic. I don't think we'll talk about this too much, but the first one that we really saw popping up is one that has been brought to me by, I'd say, a number of agents in the past couple of months. Kathi, I know we talked about this last month too. So it's really important because I think it's going to become even more prevalent as we get into open enrollment when obviously the agents are most active. So one of the things we've seen is a lot of agents are receiving emails recently where it'll be like a client or somebody impersonating a client, so to say, and they'll say, hey, I know you're an insurance agent, I found your information, can you hop on like this Zoom or this Google Meet link to go over my benefits? And if you aren't really paying attention closely, an agent might click on that link. And then really what it is having you do is install some sort of malware on your PC. I haven't had like a catastrophic scenario with this yet, but it could be some kind of malware. It could be some kind of program that would allow them to take control of your computer or take your files hostage. So just really be aware. I know as things get hectic during open enrollment, you want to help everyone out at the drop of a hat, really be responsive on your service, but make sure you take a second. Anything that maybe puts up, one of those red flags in your head, take an extra moment to look at that email and make sure why is this person reaching out to me directly and sending me an invite link? Kathi, what would kind of be as an ex-agent sort of your best practice there in terms of actually like setting a meeting with a client?
I want to set it. I want to control it. I want to set it. I want to control the platform that we're using, just so you can know what you're walking into. But it's weird to do a Zoom or something right away without talking to somebody. I think,
Right.
I'm a little old school, but Maybe have that conversation first. Hey, can we chat? Find out, do your due diligence. And that's with any client, not only the Zoom clients, because we might get a client, and we cover this all the time in our training, where individuals on the marketplace don't really know what to call it, don't know really the carriers, and you could be wasting your time because they think possibly they don't have the marketplace because they're just not aware of who is what carriers are available and who they signed up with. And then if you don't search for them, you start the application, you've spent this time, and then you realize they have an application in there with another agent for the same plan, and there's nothing you can do to beat it, right? It's the same premium. And so kind of the same thing. Vet your clients. Just because they're coming to you doesn't mean, especially right now, what we see going on, doesn't mean that it's legit.
Yeah, exactly. And that's why I kind of wanted to reiterate on this point, because during open enrollment, obviously the option is there, but especially at this time of the year, just straight up having a benefit discussion is really not where I would even start with a client if I were in an agent's shoes. I would say, hey, what kind of insurance do you have? Have you had like a recent life change, like a move, or have you added somebody to your family? Did you have a change in your job or your income? Those are sort of your qualifying questions as well. So if you feel like you're getting anything that seems a little bit strange, definitely take the initiative to reach out to that person first and be like, hey, let's kind of do this on my terms, in so many words. And actually, I see in the chat here, Sandra said that she ran into one of those herself. So good on you, Sandra, for being vigilant, and just keep an eye out, everybody. Um, Another thing that we were talking about, Kathi, was around this time of the year and leading up to open enrollment, we see sometimes agents, or rather agencies, will send out like just a huge, massive onboarding invitation. So some of you guys might get something for like United Healthcare or Am Better, and you're like, I didn't really request this. Why is this agent sending me, or an agency sending me a contracting invite? Be aware, because we've had it happen a lot where somebody will request something from JSA. Just so happens that the timing is kind of a bad coincidence there, and they will accidentally do, some kind of invite from another agency. So always check with JSA if we're sending you something, or just make sure that you're reading that really thoroughly, because we don't do that personally, but a lot of companies have the ability to send out thousands and thousands of invites at one time. So if you're contracting actively in the next couple of months, which of course, we'd encourage you to do if you're getting ready for open enrollment, just make sure and check with us. Hey, did you send that to me? Does this look right? We are absolutely always there to help you guys out.
Yeah, that's great advice. We 99.9% of the time have a conversation. I'd say 100. I've never sent a contract out without someone requesting it.
Well, I'm telling you. Yeah, I'm telling you if it's coming. That's for sure.
Yeah, so I can tell you, just from my NPN number, I've gotten the same text. That's what brought this up with Alex, probably 10 times this week. And it spelt my name wrong. It has JSA attached to it, which has nothing to do with my broker license. And it's a reminder to complete my ACV2 onboarding form so we can review and prepare your invoice. I won't mention the company, but then funny thing, after I mentioned it to Alex this morning, now it's showing up in my spam, my work spam, which has nothing to do with me as a broker, right? So they're pulling this information from something, and I could easily click on that and be like, because to me, I'm like, oh, I must have to do something for ACA onboarding, especially if I'm new that I'm not aware of. That sounds like a simple thing I need to get done, right, in order to be able to continue to sell. But it's not, has nothing to do with being ready to sell. It's just a
Yeah,
contract with another agency, FMO, for contracting.
happens all the time. And, some agencies will just cast a wide net and see what happens. And then if you
Sure.
unfortunately happen to write anything, you might find that your business isn't yours going forward. So again, just make sure you know what's coming to you. We'll let you know as well if we send something, and keep an eye out for any sort of unscrupulous emails or outreaches that you might be receiving as we get closer to open enrollment. Um, One thing here, I'm looking in the chat. I see that somebody asked for the recording. I will certainly get that over to you. Everyone's going to receive a recording today. And Raj, you asked about if you're new to ACA, where can you start? You are absolutely in the right place, my friend. I'll have some resources for you guys in my follow-up email, or of course, just feel free to reach out to us. We can absolutely get you started on your first steps. So here is kind of what I consider the main topic of today. Even though, again, I don't want to hit too much time on this or the next so that we give Saeed his flowers here. But this is pretty interesting. I actually just found this yesterday. So Kaiser Family Foundation, I don't know what kind of wizards they got working over there, but they always seem to have the most proprietary upfront data I can find in the marketplace. They're doing the numbers over there. So this is a graph of what we are seeing so far for 2027 proposed rate changes. And this is about the earliest information you're going to get on the marketplace. If anyone is veteran, you know that the marketplace keeps all that stuff pretty close to his chest before open enrollment, and we're really not seeing a ton of information until that time. Rate filings are one of the few things that tend to pop up a little bit earlier. And with that, this is what we're seeing for 2027. So this is a graph showing the median or average of proposed rate changes among 276 different marketplace insurers. Now, that seems like a lot to me. Obviously, we don't work with that many carriers, but there's a lot of small regional players out there. So this is really a big amalgamation of the proposed rate increases for the filings that have been done thus far across the federal marketplace and the state-based exchanges. So to kind of put this into layman's terms, we're looking at an average of about 10 to 15% of a rate increase across all plans for next year. And obviously we have this spread out. Some are going to be less, some are going to be more. But as a median, I would say most commonly you're going to see between 10 to 20% of a rate increase across the vast majority of plans for the marketplace next year. Now, traditionally, that number for the ACA is usually around maybe 7 to 10%. So it's not a huge jump from what we've seen historically in terms of rate increases for the ACA. It's probably going to be a little bit less than last year because the subsidies are staying the same, at least from what we know thus far. But as a base rate plan change, it's a little bit higher than what we've seen in the past. So what's the takeaway here? I would say that the takeaway is going to be expect higher premiums on the marketplace, expect to be a little bit more hands-on with your clients this year, but expect them to not have to worry so much about their subsidy changing. So if somebody is getting a subsidy, they are very likely, as long as everything else remains the same, going to be getting around that exact same amount of money for next year. Obviously, when you run the quotes, you'll see it. But this will be another year to be hands-on with your clients because we're going to see some rate changes. And again, those agents that aren't touching base with their people, they are going to have clients seeing their rate increases and being like, what the heck? Why is this going up again? So it is a good year to be reaching out to everyone to make sure that they know what's available, because you're going to want to change around some of the plans this year, just based on what we're seeing now. And this is pretty sure data, but very preliminary. And with what we're going to talk about next, we might, still see some changes to the marketplace. We might not. Anything else on this one, Kathi? That's really the long and short of it.
No, I don't like to spend too much time on it because it's just a preview, right? And it doesn't give us any real numbers, but we just know, just like in the Medicare world, you've got to pay attention and not have shock when things happen. We're going to have increases. It's the world we're in right now.
Yep, exactly. So I think that kind of segues nicely where you said it best earlier, Kathi. They got to stop calling this thing the final rule.
Let's draft the rule, and we've got some changes going. So last year, if you remember, if anybody was with us and selling ACA, the final rule for 2026 that didn't get finalized had some of these revisions in there. But what we do know is hopefully we'll have a few of the things come to fruition. Yes?
I mean, yeah, I certainly hope to see, some amendments to the ACA. I really hope that there are certain things that they do change, certain things that they don't. One thing that I certainly hope they don't change is just eligibility in general. We have a lot of options for people to get into the ACA right now in terms of their residency status. And I know we work with a lot of populations that are in need of the coverage. So I hope to see that they keep that open. One of the things that I hope they do change are just more plan availability in general, of course. And the way it stands now, we expect to see a shortened open enrollment. I hope they change that. I hope it gets extended again so that agents have a little bit more time to sell, because I know how busy it gets for some of you guys doing double duty. So to break this down quickly, what was already proposed from CMS this year is the quote unquote plan and perimeters, payment perimeters final rule for 2027. Essentially, this is the dictation that governs the marketplace and how it's going to operate. For you as an agent, we had a few big takeaways. A revised standardized consent letter for the federal marketplace, further SEP and income verification, FFM training changes, mainly those are going to be only through CMS. They're standardizing the process, and then again, a shortened open enrollment. So last year we had it to January 15th. This year we expect it to be December 15th. Now, that's what they proposed. But wait, we have, same as last year, actually the same exact district court in the city of Columbus, which is in Maryland, essentially saying a lot of these rules are unconstitutional, specifically the SEP and income verification, the introduction of what they are calling non-network plans, and the eligibility changes for those that can actually enroll into the marketplace. So, is it a final rule? Definitely not at this point. It has effectively already blocked some of these provisions. We're going to have to see some kind of a revised final rule. And then just in the past couple weeks and now 21 states in total are essentially joining that fight. So whether it's for good or for bad, we'll talk about all the sort of ramifications and what this entails as we go forward here. But really, all that you need to know is that this is a pretty big national lawsuit at this point that is being led primarily by the attorney generals of New York and New Jersey, predicated on the fact that they saw large disenrollment in those two states in particular due to some of the ACA and subsidy changes last year. So they're sort of spearheading this fight right now. And really, they are proposing what was introduced originally in the One Big Beautiful Bill Act last year, along with the current final rule. So, Kathi, really, what's the takeaway here as I throw my hands up?
Well, we'll wait and see what they say if it's final, because there is no real takeaways from this. We keep trying to take something away, and it might change. So there's no definite yet.
Exactly. So, what can you do as an agent? Little bit of a self plug here. Tune in next month. Tune in the month after that. This is where we like to talk about it. So, just try to stay abreast of the situation. If anybody has questions along the way, Kathi and I are available. We're more than happy to look into it for you. I try to keep my finger on the pulse of all this stuff. And as an update, it looks like we're very likely to see some kind of new healthcare initiative from the current administration within the next month. How that's announced or where it's going to actually lie between the House and the Senate remains to be seen. But we know that there's going to be further healthcare reform proposed this year for the ACA. By no means will it be a replacement of the ACA. I think from everything that we've seen the last few years, the ACA is here to stay. Maybe that should be our new slogan.
Yeah. It is here to stay, and there are initiatives coming. So this is not a bad thing that we don't have a final ruling. That just means that, we're able to challenge it and see what happens.
Right. And, we get a little confused along the way because it's always a flip flop. So just keep in touch with us. We're going to keep in touch with you and make sure that we know what's going on and make sure that you guys know as well as us. So keep an eye out. If there's any changes in the next month, I will certainly be talking about that on the Let's Talk podcast, the biggest of which was potentially changing the way that the subsidy works, like putting those dollars directly in the hands of the consumer. And then what I mentioned on the previous slide was the like open network or open access plans. Essentially non-network plans. They're sort of like catastrophic coverage, but it allows a client to go to any provider. Those really haven't been finalized on how those would operate through the marketplace yet. That was part of the initial healthcare reform that was introduced by the White House, I think, in like January of this year. So we hope to see maybe that skeleton built upon and see what kind of ideas they have to implement on the marketplace. Of course, pending approval of Congress. So we will keep all that boring stuff to the side for now and make sure that our lovely guest Saeed has time to go over what he would like to go over. So I'm going to stop sharing here and Saeed, take it away. We'll have a little bit of time for Q&A and wrap up at the end, but the floor is yours, my man.
Perfect. Thank you, everyone. Again, my name's Saeed. I'm one of the broker account managers with Pivot Health. If you are already appointed, you may have gotten a marketing email from me with my contact info. So you can always give me a call or shoot me an email if you have any support needs, if you have trouble getting into the agent portal. I'm going to share my screen now, guys. Can you see that presentation?
Yes, we can see it.
All right, perfect. Now, if you're not yet appointed, some of these things may not resonate with you, but once you are appointed, I'm happy to kind of give you a refresher. We also do national distribution webinars roughly every week or two that you can register for through our website as well. If you want to attend those, they're all recorded too. So we'll get started. Just in a nutshell, our Pivot Health plans are all under 65 plans and they are not compliant with the ACA. So I like to start first with a comparison for what our niche is, which is off the marketplace, versus the ACA compliant plans, which are through healthcare.gov. And if you're in states that have their own respective marketplace for the ACA compliant plans. So in a nutshell, of course, Kathi and Alex reviewed the enrollment period where you are required to, well, you're not required to make a decision, but most of the decisions that you can make are during that enrollment period unless you have a qualifying life event. However, with short-term medical, our product here at Pivot, you can truly enroll any time throughout the year. There is no set enrollment period. We can have you submit an application today. The policy can start as soon as tomorrow. You can also post-date those policies up to 120 days, so you can anticipate some transition that your client is going through and actually post-date a policy well in advance, just to lock them in. Now, the ACA plans are permanent coverage, so typically you'll keep that plan for all 365 or 66 in a leap year. All of the days of the year, you can keep that ACA plan. However, with Pivot Health, our plans are typically going to be, where states allow, they can be up to 3 years of coverage. However, it would be 3 terms of 364 days. And those plans are available in 16 of the 32 states where our products are available. You'll also notice, of course, when you're going through an ACA application, those are guaranteed issue. They are not really asking you any health questions. They do ask a question about smoker status, and that can impact the rate. However, for Pivot Health, we are going to ask you health questions. Your clients will be going through what we call simple issue medical underwriting, where they answer some health questions. However, we don't run any reports up front. So as long as they can answer those underwriting questions, they will get approved and we'll be able to get them a policy as soon as the very next day. However, our plans, because of the medical underwriting, they may exclude some folks with certain health conditions. When it comes to the 10 essential health benefits, of course, you're going to get all of those on an ACA compliant plan. On the Pivot Health plans, you will get about 8 out of 10 of those health benefits. And I can tell you the 2 that are not covered, of course, are pre-existing conditions and maternity benefits. However, we will include some preventative coverage for all of the plans that we offer through Pivot Health, which is a unique thing that we do to set ourselves apart. You are able to see any provider with any of the plans that we have here at Pivot. And there are two types of plans. We'll get into that here in just a moment. However, with the Affordable Care Act compliant plans, those are typically going to be plans where, you have an HMO, PPO, and now it sounds like there may be some open access plans coming down the pipeline. So a variety of different products. But with our products, you really don't have to adhere to the network. However, you could save more money on our PPO plans if you do. And then when it comes to the cost, of course, whether or not you qualify for the subsidy is going to impact your premium on the ACA plan. However, when you're writing a policy for us, there are no questions regarding income. Again, that has no bearing on the rate. The rate is based mostly on age band, and those are 5-year intervals. So let's say, for example, someone is applying and they are between the age of 30 and 35. They'll pay a different rate than someone who's between the age of 35 and 40, for example. And then, of course, gender. We do also not underwrite based on gender, but we rate based on gender. Now, what's changed when it comes to our short-term medical plans? Well, back in August of last year, CMS allowed up to these 3-year policies or tri-terms, the 3 by 364-day duration plans. The ACA subsidies, of course, had expired at the end. The enhanced ACA subsidies, let me clarify that, expired at the end of 2025. And it remains to be I guess, undetermined whether or not those enhanced subsidies will come back, but we're not really holding our breath. So it really has given us an opportunity for plans available off the marketplace. These have become a more viable option, and they're looked at more as more of an essential decision, for folks who may have otherwise gone without a plan entirely because of how much more expensive the ACA plans have been for them without those subsidies. And in 2027, as you can see, they're going to see another premium increase, on top of what they would have seen here in 2026. So it gives you even more opportunity for, folks who are looking for an alternative. Now, it will vary from state to state as far as what's available, and we'll be able to kind of get into that. As you can see at the bottom of this slide, the 3-year durations are available only in these 16 states. In Texas, we do have a unique option. Texas was one of the states that initially, when CMS relaxed those rules, we did have the 3 by 364-day policies. However, now they've reverted back to only 120 days. But we got a really unique situation, a really good policy that you'll be able to offer as an alternative for folks who are looking for 12 months of coverage in the state of Texas. Now, Pivot Health policies are considered major medical policies. However, they are not compliant with the Affordable Care Act. They will still cover doctor office copays, hospital coverage, emergency room visits, and all of our policies do include some type of preventative coverage. How those preventative costs are covered, however, will determine it's kind of based on the plan that you choose for your client, and we can get into some of those nuances as well. We do offer plans with and without prescription drug coverage. The ones without do still have, of course, a discount card that your client can take to the pharmacy and receive discounts, similar to GoodRx. However, unlike GoodRx, there is no way to do that vetting, through a mobile app, unfortunately. So it is a little more antiquated. You would have to actually call the pharmacy with that discount card to understand what exactly they would be paying and what that discount would be like. We do also offer a proprietary dental and vision product. Our Brilliant Dental and VSP Vision is available in most of the states that have our short-term medical products. So you can bundle these things together, as well as our Latitude and Flex Benefits supplemental products. Latitude is an accident-only supplement that is a proprietary product of Pivot Health. Flex Benefits is offered through one of our partners, but underwritten by one of our 3 carriers, Companion Life. And Flex Benefits offers a more comprehensive gap protection plan that includes critical illness, accidental coverage, AD&D, hospital and also a short-term disability benefit as well. Now, what makes Pivot Health unique is that all of the plans that we offer do have some first dollar coverage, meaning that you're not required to meet your deductible first before some of these benefits can be taken advantage of, such as the preventative and wellness benefits. All of our plans do offer some robust benefits, so you'll have, some flexibility when it comes to deductibles, coinsurance, and the policies in most states go up to $1 million per person per term. For student athletic injuries, this is one thing that we do that I think, again, sets us apart from the other carriers in this realm. Pivot Health is one of the only carriers that will cover a sports related injury. So if you have folks who need insurance to play collegiate sports, we will cover their injuries as long as they are not playing professionally or semi professionally. So as long as they are still only playing amateur sports, we will cover those sports related accidental injuries. Our plans do include both nationwide networks such as a Cigna PPO network, but also we do have our open access plans, which kind of work more like a private fee for service plan, if you're familiar with that plan type on the Medicare side, where they can truly go to any doctor. And of course, as long as that provider is willing to work with our fee schedule, which is based on Medicare allowable rates, then your client will be able to receive, even more discounts than the Cigna PPO plans that we have, and even a lower premium as well. We do simplified underwriting. Again, no rate ups. So we are not going to accept an applicant and then rate up their policy or even deny them later on. We do not ask for a social security number. So we are able to insure folks even if they are not citizens. If they are a citizen, they do not have to answer this question. However, if they are not a citizen, we only ask that they have resided in the U.S. for at least 4 months prior to applying for one of our policies. Again, we don't ask about tobacco usage, so that has no bearing on the rate either. The height requirement doesn't exist in our application. There is a weight requirement, however. So there is no sliding scale where there's a correlation between height and weight. For males, it is a hard line, 300 pounds. If they are over 300 pounds, they would not qualify. And for females, that hard line is 250 pounds. We do offer policies to or child-only policies just for the children. As long as the children are at least 6 months or older, then we can get them on a policy by themselves. However, if they're under 6 months old, we would have to put at least one of the parents on the policy as well. And of course, each of our plans does offer telemedicine, unlimited copays of $0 through our partner, Clever Health. And they've got a great mobile app that you'll be able to use. And when you sign up your clients, they do receive a flyer that helps them understand how to get logged in, how to get set up through the mobile app. Now, some of the top markets that we serve for you all who are on the Medicare side, one of your top markets are going to be the folks who are trying to bridge until Medicare. So maybe they've retired and they haven't yet become eligible, or for some of your folks who are Medicare eligible, who have a spouse that hasn't yet reached that eligibility period. We'll be able to bridge them to Medicare, depending on what state they live in, of course. And beyond that, you also have the opportunity to really target folks who don't receive any type of group coverage, your gig workers, or really any type of contract worker or self-employed individual, small business folks who may not necessarily be large enough that they offer a group policy. This is a great product for them as well. And of course, again, our college athletes. And we want to really highlight the college athletes because this is, for the most part, from what we've seen, this is a very underserved demographic. Typically, a lot of universities do offer a product that you would have to pay for a semester at a time. But this is something that the student athletes, the young professionals can actually keep and actually save their parents a little bit of money. When you compare this to those plans as an alternative, this is much more economic. Now, we do offer 3 different carriers under the Pivot Health umbrella: Pan American, Companion Life, and North River. And these are all A-rated carriers. These are the names that you will see on the ID cards when you enroll your clients into one of our plans. They are the underwriters. For the Sure Care plan, this is one of the plans that I'm going to highlight first because of how robust it is. it offers the best preventative coverage. So unlike the other plans that we offer that have an actual allowance when it comes to the preventative care, this plan, you pay a $50 copay for that preventative wellness visit, and then there is no limit to how much we will pay when it comes to those preventative costs. It doesn't have the cap that the other plans that we offer actually have. So this plan does offer doctor visit copays. It's a $30 copay across the board for primary care specialists and urgent care. So it's actually the lowest copay plan that we offer, alongside some great benefits for preventative care. The OBGYN visit is covered before you've got to meet your deductible, as well as mammograms, PSA, childhood immunizations. And keep in mind, this is one of our open access plans. So that does mean there is no network to look up doctors or facilities. Truly, your client can go to any provider and any doctor as long as they're licensed. Now, under Companion Life, our second carrier, this particular carrier offers the most products under our umbrella. So you've got the Core Light plan, which is sort of a skinny, limited benefit plan that in some ways kind of works like a fixed indemnity plan around hospitalization. So I wouldn't necessarily offer this to someone as your best recommendation. I would say this one would be if your client doesn't have a high budget and they really would like something that still offers them, the ability to get doctor visit copays, prescription drug copays, and some hospital benefits, but, to a limited extent. The classic plans are actually our most popular plans under Pivot Health and under Companion Life. This includes the Economy, Choice, Standard, and Deluxe plans. Now, keep in mind when you are selling in a state that has the 300 or the 3x364-day duration, 2 of the 3 of our carriers will do a rate lock. I forgot to mention the Pan American Sure Care plan is one plan that can be offered with that level premium for all 3 years. So you will get a rate lock on that particular plan, as well as any of the plans under Companion Life. This is the other carrier that when you sign your client up for the tri-term policy, they will have a level premium for all 3 12-month terms. So that's another selling point. You can offer them that peace of mind that they will not receive a rate increase for the life of their policy. Now, our Quantum plan is our premier product. This is actually the only plan that we offer that covers your clients outside of the country. So this is a strong selling point if you have clients who like to spend some time going abroad. This is the only product that we offer that will cover them outside of the United States. Now, this uses the Cigna PPO network, unlike all of the other plans that we've discussed so far. So in this particular plan, you can look up providers to see if they are in Cigna's network or outside their network to understand what those discounted rates would be like and kind of make an estimate on what those costs would be. Now, the Quantum plan does have a copay version as well as a high deductible version. It does offer a lot of flexibility when it comes to deductibles as well. And of course, it does still include those preventative and wellness visits as all of our plans do. And last but not least, our third carrier, North River, offers both the Epic Base, which is the open access plan, and the Epic PPO, which is the Cigna PPO plan. One of the great things about the Epic plans is that it has a 100% coinsurance. So for your clients who are conscious about meeting that stop loss and what, could be the worst case scenario if they hit that catastrophic limit, well, on these 2 plans, your deductible is actually your max out of pocket. So it's really easy to understand, and clients really like the idea that they don't have to hit a second catastrophic threshold before they meet their true max out of pocket. This one works very well when you're pairing it with supplemental products because it's easy to explain how those supplements will fill that gap. And then once they've met their deductible, then they're 100% covered by the plan. You'll also want to make note that in the states of Georgia and Texas, our Cigna PPO network plans are not available. So if you're licensed in those 2 states, the plans that you can offer there will be open access. And you might ask, why would you sign your client up for 3 years of continuous coverage? Well, it's for peace of mind. Since these are policies that are medically underwritten, you can secure a longer duration of coverage for a client whose situation will be ongoing and it's not going to change. They're not going through necessarily a transition. They truly are looking for an individual option long term. And for those folks, you can give them the peace of mind knowing that they only go through that medical underwriting once every 3 years. Now, if you're licensed in the state of Texas, going back to those CMS rule changes, Texas, unfortunately, the way that they acknowledge those rules, they kind of rolled back their stance. And last November, instead of offering the 3x364 duration, they went back to only offering 120 days of coverage at a time off the marketplace. So what that means is because Pivot has 3 carriers that we work with, we created a 3x4 policy. So it still offers your client 12 months of continuous coverage, but every 4 months, they'll be with each of our 3 carriers. So it's still 12 months of continuous coverage. However, every 4 months is its own insurance term. So it has its own deductible and max out of pocket and term limits. These will reset every 4 months when your client is on this particular policy. The policy does still have copays for doctor visits. It covers hospitalization, emergency room visits, preventative care, of course. These are all open access plans as our Cigna PPO plan is not available in the state of Texas. And all of these carriers for this iteration of the 12-month solution that we have will only have prescription drug discounts. So none of these products will offer any prescription drug coverage, only the discount card, just to make you aware. And our ancillary products that can be added to the short-term medical products right through our quoting tool are the dental and vision plans that we offer through Brilliant Health and VSP Network on the Vision. And then for our supplemental plans, of course, you've got Flex Benefits and our proprietary accident product, Latitude. These can be added as an attachment or sold as standalone policies. And one thing I wanted to point out for our Flex Benefits product, we actually have a line of Flex that you can pair with an Advantage plan. It's a completely separate line than the line that we offer through the Pivot Health quoting tool for over 65 Medicare beneficiaries who are on an Advantage plan. Now, that one we call Flex Advantage, and I'll show you how to get into the carrier portal to quote that one too, if your client's looking for something to fill those gaps, since some Advantage plans also have some cost sharing and some out-of-pocket expenses. Now, looking at the rollout of our new website, this is the layout here. We updated our website roughly about a month and a half ago, just to make it easier on the eyes, more user-friendly. And then shortly after that, we also updated our quoting tool to make it more of a shopping cart-like experience, which is more modernized to, I guess, compared to, like your Amazon marketplace or things like that. Our previous platform would show you all of the plans all at once. So we believe this is going to be a lot more user-friendly and, just a lot easier on the eyes, not so much blank space as well. So I'd like to take some time to go into a demo if we've got some time, guys. I know we left some time, but before I do that, are there any questions that you all have before I just kind of dive right in? I know there's been quite a buildup. I can only
So
imagine.
California, I addressed this in chat. California and some of the states do not have short-term medical, and it has nothing to do with the carrier. It's a state decision.
Correct. And to add to that, Kathi, most of the states where there is a state-run ACA marketplace, those are the states where our products haven't really been approved. They're more difficult, and unfortunately, it's just what's available off of the marketplace is really minimal on the medical side. But our ancillary products are there.
We have a question. Are they all PPOs?
They are not. So many of our plans are open access, and we also use the Cigna PPO network for the other plans where those are available. However, both plan types do offer the ability to go to any provider in any facility as long as they're licensed.
Are you available in Kentucky?
Yes, we are. Yes. And we even offer our tri-term policies in the state of Kentucky so they can keep the coverage up to 3 years.
Saeed, I think you said, what was it, 32 or 36 total states available?
32 total and 16 have the tri-terms.
Okay, cool. Yeah, if anybody wants like a full product chart for where Pivot
Yeah.
is available,
Sorry
we
about that.
will absolutely follow up in the email with that. Again, if you have a question, I do see somebody raising their hand. Just please put that in the webinar chat or the Q&A, and we'll get that answered for you. We are coming close to our time side. If you want to just give a quick demo and then we'll do a wrap up,
Absolutely.
I think that would be good.
Absolutely. So once you get logged into the agent portal and the main website for agents, I can drop this in the chat real quick just so you all have it for those of you who haven't been to the website before. So give you an opportunity to get logged in. There you go. And you can bookmark that page. Now, if you haven't yet received your credentials, then you'll just want to follow along. And when you do finally receive your credentials, reach out to me. We can do a refresher course. All right, here we go. Now, this is the main page of the agent portal. One of the resources that you just mentioned, Alex, the state availability chart is right here under quick access. So feel free, you can bookmark this page, but I wouldn't download it because we do update it as states update those products available. If you bookmark it, then it will update as our marketing team updates it. And we'll just dive right into the quoting tool. We're going to click on get a quote. And JSA, since you all are a national agency, we can really do a quote anywhere. What would you prefer? Someone give me a zip code.
Let's do my home zip code, 54180, Brown County.
All right, good deal. And we're going to do Alex. And Alex, what's your date of birth?
5/15/1993.
Now, if you want to email your clients this quote, you'll want to enter the email address now. Otherwise, it won't give you the ability to email the quote later. When it comes to the phone number, I would recommend entering a phone number, preferably a cell phone, because if your client doesn't complete the application, we will send them text messages to remind them. So free marketing if you obtain their cell phone. And then, of course, you can add a spouse and, dependents before we go on, but for time's sake, we'll just go right on through. All right. Now, since we're in the state of Wisconsin, just a couple of housekeeping things. So Wisconsin does allow up to 18 months of coverage before you're capped with that respective carrier. So what we've done is we have a 364-day policy, and 2 of our 3 carriers offer that. So in order for you to keep a client on our plans, you could just alternate between those 2 carriers if you like. So for example, we'll choose the Epic PPO. This is the Cigna PPO plan offered in the state of Wisconsin. I'm going to choose $1 million worth of coverage because we don't want to, shortchange our clients. And then we'll choose a $5,000 deductible. Keep in mind the Epic PPO plan has a 100% coinsurance. So when your clients met their deductible, they've also met their max out of pocket. So beyond that $5,000, they're covered 100% for the rest of the year. Now, you can also compare up to 3 plans. So we'll take a look at some more plans. If you notice, this particular iteration of the Epic PPO also has RX. This one does not. So comparing those 2, just match apples to apples. Looks like it's roughly about a $33 difference per month. Not too bad. We'll add that one to compare, and then we can add a 3rd plan. I do want to point out that in the state of Wisconsin, Companion Life only offers a product that's 120 days at a time. And you'll see that from time to time in different states. You'll want to make note of that when you're running these quotes and getting your clients enrolled, because if they're looking for a longer duration, you may want to cross-reference the state availability guide to understand which durations are available within that respective state. Now, along with these medical plans, you can add the ancillaries. What we'll do is we'll add something to the cart, and then you'll see the ancillaries start to pop up here. So we can add Flex Protect, and we can even customize it. We're going to change that disability income benefit to $1,500, max that out. Now this we're just going to change to $5,000 to match that deductible. We'll get them something appropriate for the plan that we're recommending. Now up here is where we're going to add the dental and vision. We're going to click on this tab here. Now I often do not even recommend the value plan because the price difference is so minimal between the value plan and the essential. And the value plan is the only plan that has waiting periods. So I typically only stick to the essential and the maximum. So we're going to go middle of the road, go with the essential. And then over here, out of there, we're going to click checkout. Now we'll check them out if we're doing a broker assisted app. But if we're not, then what we want to do is we want to go back to short-term medical, and then we're going to click email this quote if we want to send it over to our client. We're going to enter their full name, their email address, and then our agent information is going to pre-fill here. And you can also enter a personalized message before you send this out to your client. Now, once you have submitted an application, well, actually, why don't we go through it since we got a little bit of time. Once you check out your client and you're doing a broker assisted app, you're going to go right into the eligibility questions. Now, these underwriting questions are all simple issues. So as long as they can answer no to all of these questions, then they'll be able to proceed and get a policy. Next, we're going to gather the rest of their personal information as well as their payment method. Then we'll go through a couple of disclaimers that will vary depending on the state where you're selling. Once you submit this application, we will draft that first monthly payment. And I want to clarify that we do draft the payment before that your client completes the electronic signature document that comes after this submission. So you'll want to let your client know that upon submitting this application, they'll receive an e-signature document. You're copied on that document as their broker. And once they complete that document, you're also copied on the completed version too. And then after that e-signature is complete, you'll both receive a welcome email. And then the client also receives a member portal registration email so they can access all of their policy documents. They will not get any postal mail. Everything is email. And if you have any questions as far as how this all works, we do have a great guide through the agent resource page that allows you to kind of just walk through a PDF of, what to expect when you're submitting an application. Now, I know we're at time, guys. Are there any other questions or any other concerns that you'd like me to cover?
Great information, Saeed. And everyone, just know that it doesn't cost anything. You can get contracted within a couple days and start quoting. And the effective date could be the next day.
Okay, so a few final things here for y'all as we wrap up. And again, thanks for spending your afternoon with us, everyone. All right, so first off, one of the things I really like about Pivot as our short-term medical partner is what you said, Saeed, about the non-citizen requirement and student athletes. I'll tell you guys right off the bat, some of the other short-term carriers we work with are not going to cover student athletes. That is a big one that I see a lot where parents will have a kid go out of state for college, especially athletes. Some schools will require them to have some kind of insurance to participate in those sports, whether it's at a collegiate level or intramural. So that is a huge one to pivot, because we definitely do not see that with everyone. Now, another one is their residency requirement. Only 4 months in the US. That is also a little bit of an anomaly in a good way. Makes it very easy to cover foreign nationals visiting the US for extended periods of time, people waiting out their green cards or citizenship, whatever it might be. Very, very easy to work with all kinds of different clients just through the Pivot platform. So, as we wrap up here, just want to let you guys know, we have some brand new ACA marketing pieces in our pro shop. Here are a couple examples from our wonderful in-house graphic designers. You guys can go in there, customize these. They're all free to use. The proofs are free to use. Put your number, put your agent information on there. We got social media pieces, flyers, tear-offs, business cards, everything that you guys need. So go check out the pro shop that is in our agent resource center on the website. And with that, we have webinars going on still every single month up to open enrollment. If you are in the area of one of our local offices, check out our boot camps. We're doing in-person boot camps, half-day crash courses where Kathi and I are going to be giving you guys all the tools you need to get started selling under 65 products. The signups will be in the email. Go and check those out, as well as any of our ACA 101 and short-term 101 webinars that we're going to be doing throughout the end of the year. And if you guys want to do that on your own time, we have a ton of information and video on demand trainings in our Green 365 training portion. Again, on that Agent Resource Center. So go there to get your knowledge up and get your marketing pieces up as well.
Alex, where are we going next?
Next, we will be in California in 2 weeks. That will be on, I believe, what is it, the 20th?
20th? Yep.
In California. And after that, we will be in Wisconsin. So excited.
We'll be there on the 17th, and just added, due to popular demand, since I have located from Florida to my hometown now, Tennessee, Nashville, Tennessee, we are hosting an ACA boot camp on September 9th.
Fantastic.
Yeah.
Excellent. All right, so we have a little bit of Q&A here. Again, thank you guys for hanging out with us. If anyone has any final questions, please feel free to put those in the chat or the Q&A. And again, you'll get a follow-up from me either today or tomorrow with a bunch more information and the full recording of the session. So just going through here, Anthony, Silly Shark, not sure if you're still around, but this is the Savvy Shark, not the Silly Shark. This is your insurance shark. I want to make all of you shark agents able to hunt down those prospects that are in need of your wonderful services. Raj, again, you asked about a new agent starting ACA. You still got plenty of time. You're in a great spot right now. We will get in touch with you and make sure you have what you need. Al Kareem asks, what carriers are in Florida? I always send out our product chart. So we will have the product chart in the email for you guys, all of the products we have available everywhere. Sandra asks, is the ACA enrollment still being modified? In general, a lot of that is still up in the air right now. We're not exactly sure how long open enrollment is going to be. The estimate is November 1st to December 15th for this year. That could get extended. We will see. I'll be putting Pivot Health's product chart and some of their contact information in my email again. The minimum time for a short-term medical plan is 1 month. Let's see here. Also, just to quickly touch on the tax penalty for the ACA, still in some states, California and New Jersey are two of them off the top of my head. If you're working on the federal marketplace, you don't have to worry about a tax penalty. If you are in the state of California, short-term is not available there anyway. Hey, I think that's pretty much all we have. So I'm going to say thank you so much, everyone, for joining us for our anniversary episode. It's my pleasure to be here with Kathi this afternoon, and we are at your disposal for anything that you need. So thanks again.
Happy anniversary, Say, to you and your wife, and happy anniversary to us.
Thank you for joining us, everyone. Have a great rest of your day.
Thanks. Bye now.